Recording now.
Okay. All right. Good morning, colleagues. I think we've got about, it looks like 635 of us on together this morning. Thanks for joining us. We appreciate it very much. I'm here with Dawn Staley, who is our Deputy Director for Health and Medicaid, Jeff Williams, who is the Head of Emergency Response here and Emergency Management here at DHS, Deputy of the Office of Security and Compliance, and Ashley Beatty, who's here as our interpreter to help us make sure that we're able to communicate well with all of you. So we wanted to take just a few moments today to really kind of give you an update of some information that Jeff shared with us the other day at executive team around what is happening here in Arkansas regarding COVID-19 and the variants and the rise in cases. As some of you may have heard this week, we've had to close Conway Human Development Center again to visitors due to the rise in cases and what's happening there. So we wanted to just make sure that you all had the information and were current as to what's going on. So I'm going to turn this over to Dawn and let her and Jeff really talk all of this through with you. Dawn?
Thank you very much. And as we go through today's update, really want to just talk a little bit about what's going on in Arkansas, but also hopefully if y'all have questions, as I'm sure you do, to continue this as a dialogue going forward, whether that's, reaching out to us if you have questions, and certainly Jeff can talk more about that, but also continuing these conversations within your own teams and work units, as it's very important that we keep up with what's happening as it's a quickly evolving situation. So with that, Jeff, we are starting to see more cases, right? As we look at the news every day, it seems like we've got an increase in cases here in Arkansas, and talks about a resurgence or a wave 3. Can you talk a little bit about what that means and what the situation looks like here in Arkansas today?
Sure. I mean, I think everybody sees the news, that whether they get it through social media, reads the paper, hears it on the radio, wherever. But cases are resurging. We're seeing that. Yesterday, we had the highest reported number of cases in about 3 to 4 months. We had nearly 700 new cases that were reported yesterday, and with that, we are seeing a increase in hospitalizations that are occurring, just naturally a part of that process, and the cases just continue to rise, and are primarily a function of the variants that we're starting to see coming into Arkansas.
Great, and I know you mentioned the word variant. I want to follow up on that here in a minute, but as we look at what we're seeing around the rise in cases and particularly hospitalizations, can you talk a little bit more about what that looks like here? Like, I know in the first, kind of phase that we had here in Arkansas, a lot of it was really focused on like our parents, our grandparents. What does that look like now as we look at the situation here in the state?
It is a completely different picture. It just as Dawn, just as you mentioned, the last year during the summer and during the fall, going into the winter time, and even the early part of this year, if you had the opportunity to walk through a hospital, through the ICUs, through some of the the areas where they have the ventilators and such, you looked around, it was almost an expected crowd that you saw there. They were generally older folks, folks that had other underlying conditions that existed. But most of the time, if you looked at a bed, you'd see somebody in their 70s or their 80s that were being assisted in the hospital or were on ventilators. That has completely changed now. If you walk through those same wards right now, you'd see a lot of people who are in their 20s and 30s and 40 years old, and it's kind of eye-opening to see that, because you would generally, or in most cases like this, you would expect an individual who was young and healthy like that and had no underlying conditions. Even if they became infected, they'd be able to handle it at home. They may have a few days of not feeling very well, but even a couple of days of really feeling really bad. But in the end, they could handle it at home, or maybe with a little bit of their primary care physician's assistance in getting through it. But these days, because of the variants that exist, and because of the types of diseases that it causes and the transmittability of it and all like that, you are seeing a completely different crowd in those rooms.
That's very helpful. And you mentioned the word variant twice. And I wondered if you could talk a little bit about that, because I know as somebody who has a young child, I think about things like Spider-Man or like teenage, people have this idea about this variant like being something that crawled out of a sewer or something. And so can you talk a little bit about what that means and help us put that in context?
Sure. When you work in the virology field, et cetera, so a whole bunch of terminology that can make it really difficult for people, I guess the average person to understand. And the best way I've found to be able to describe what a variant is, you hear people say mutations and you hear all these things. The reality of it is the best way to describe it is describing it like something we're familiar with, which is the flu. That's the way I've been using these last few weeks to talk about it. We're all very familiar with the flu, and every year we have to go in and get a booster shot. And the reason we have to go out and get a booster shot is because the viruses that cause these illnesses, they change slightly. They're constantly going through minor changes that occur, but those minor changes can have big impacts on the individuals who may be exposed to them. But what a variant very simply is, this is just a minor change in the virus that causes the COVID, in this particular instance, the COVID. What we're so used to is the flu. And when those changes occur, you have to adjust to those changes that have occurred. Just like each year you go out and get a booster shot or go out and get your flu shot, and it's based upon what they believe is going to be the primary type of flu that's going to be existing in your area in that coming year. It's the same thing with this. We're just seeing changes that have occurred within it. They can call it the mutation, you can call it a variant, but really it's a change in the virus, or in this instance, the virus that's out there.
That's a really great way to think about it, because I know that's something many of us think about is like, oh, okay, with the flu season, kind of which people ask like which version of the flu shot did you get, and how helpful is that, right, in being able to prevent you from getting the flu each year. So I want to talk a little bit about some of the numbers that are out there, right? Because we've talked about case numbers, but now with the variants, or basically these different types of the virus that are out there, there's a lot of numbers being thrown around, with regard to this one is much more this one is much more contagious versus that one. I mean, can you help us simplify that and think about versus kind of the first form of the virus that was out there versus some of the ones that are currently kind of circulating throughout the country and throughout Arkansas right now, like helping us understand like what does that mean, like what does it mean to me as somebody who could potentially catch this virus, versus like the one that's out there now versus the one that was out there like a year ago.
Well, it really comes down to, here in Arkansas, there's a number of different variants that are circulating through the community. Most of them are tiny, rare individual circumstances, or 2 or 3 that aren't really that I'll call it that big of a deal, because they aren't very prevalent in the community. The 2 that are primarily prevalent, and I'll speak about one of them a little bit more in depth, but the 2 that are primarily prevalent here in Arkansas are the Alpha variant and the Delta variant. The Alpha variant has about a 50% higher chance that you're going to catch it if you're exposed to it, and it's going to cause us a little bit of a more higher levels of illness. You're going to become a little more sick in doing that. But the primary one we're concerned about right now in Arkansas is the Delta variant. Even though it has less numbers than the Alpha, it's catching up quick. I mean, it is increasing by 50 to 100% a week that we're seeing. And so we'll talk a little bit about that. The Delta variant, to try to give you just in the numbers of idea there, is that Delta variant varies from about 70 to 80% more transmittable than the original virus that was out there. But what's also really kind of stands out there is that it causes an additional about almost double hospitalizations from the original. I think the last study that I read, which was late last night, was about 85% increase in hospitalization. So not only with the Delta variant, not only do you have a 70 to 80% greater chance of getting it if you're exposed to somebody who has it, but there's nearly a doubling of the chance that you're going to go to the hospital. And I think Cam Patterson of UAMS really kind of hit the nail on the head with this Delta variant. What they're finding in many cases is that the disease also progresses very quickly, where before you might become sick, you may have to, it gets a little worse at home, you go to the hospital, They check you out. They may admit you into the hospital. They may just treat it. They may admit you or not. And then if things really start to go downhill, you know, they in the end, they may end up putting you on a ventilator. But that normally takes days or even weeks for that to progress, a week or two for that to progress. Cam Patterson talked about the other day was the fact that they're seeing people that are coming into the hospital are being exposed one day, hospital the next, and on a ventilator, you know, another day or two later. And that's, I mean, that's a very quick progression from what it originally had been. So as I said, you know, 70 to 80% greater chance that you're going to catch it. Nearly a doubling of the chance that if you do catch it, you're going to get hospitalized. So this is the Delta variant is a much more powerful virus than the original variant was, or the original virus was.
That's really helpful. Thanks for helping put those numbers in context and thinking about kind of what that means, you know, for us in general. You know, getting a little bit more specific, you know, I know one of the questions that I'm often faced with, as I'm sure others have as well, is what do those numbers look like, right, if I'm vaccinated versus if I'm not vaccinated? Can you talk about that a little bit with regard to particularly this new variant?
Sure. You know, if you have to pull good news out of some of these reports, the good news is for those who have been vaccinated, we're finding that all of the vaccines, pretty much across the board that have been studied in this, and now by this point they've studied the majority of them, are very, they protect you very well, even against the variants that are out there. And although you see a tiny decrease where, so for instance, the Pfizer vaccine may have been, you know, 93 to 95 to 96% effective against the original. You may see it drop down to 82 to 92%. So it's a tiny bit lower with that, with the variants, but the numbers are still very effective. And you know, the answer to it is the greatest thing that you can do to get to avoid becoming, you know, ill and possibly hospitalized from those variants is the same thing that it was before. It is, you know, maintaining your social distancing, washing your hands, and primarily and most effectively getting vaccinated.
Great, that's very helpful. Can you talk a little bit around, you know, what this means in terms of like if I am vaccinated or if I'm not vaccinated, but in particular if I'm vaccinated, you know, can I spread this virus to other people like that maybe in my house? Like, you know, my family, you know, thankfully most everyone has been vaccinated, but you know, we you know, my son is young and is not able to get vaccinated at this point. So can you talk a little bit about what that means?
Yeah, and there's really a lot of detail that goes in your ability to be able to transmit this disease. Even if, you know, if you're a person who's been vaccinated, say for instance, you may not even realize that you're positive. You may have a very mild or completely asymptomatic, which means, you know, not having symptoms when you're exposed to it. But that doesn't mean that you aren't transmitting it. It can still be within your system. Your system could be fighting it very effectively, and you don't even notice it because of that. But transmittability is still there. Once again, the good news is those who are vaccinated, their chances of transmitting it to their loved ones, their family members, their coworkers, the members at their church, et cetera, are much lower. I mean, they're talking in the, you know, that 80 to 90% range again for you to be able to transmit it. But unvaccinated, of course, it's going to build up in your system, and as it builds up in your system, you're going to be able to transmit it more readily, more easily to other people. And when you start talking about the increased level of transmittability from the Delta virus, the hospitalization, your ability to be able to transmit it to others more readily because of the vaccination situation for you individually, there's a much greater chance that you're going to be able to transmit a much more effective and much more harmful virus. Great.
That's really helpful as we think about kind of what that means and certainly the benefits for folks of being vaccinated and certainly the impact on their loved ones. We're kind of watching a little bit in the chat box, you know, some of the questions folks have been sending us, and we've actually touched on a couple of them. But I know there was one that that came up that was actually in the list here that I was hoping we could address. And so, you know, I know that, you know, throughout the last 18 months, we've talked a lot about close contact, right? In terms of if somebody is in close contact, you know, what does that mean in relation to their ability to get, you know, the original, you know, kind of version of the virus versus now? And it seems like there's some differences, at least based on kind of what I've seen and heard. I wonder if you could talk about that in terms of what that means now with this new variant that's circulating.
Right. And as I mentioned earlier, you know, all of the same things that really are still in effect. Social distancing, hand washing, wearing a mask, social distance, etc. But, and this is an important point to make here, the contact tracing that has occurred with the Delta variant has shown that the Delta variant is being much more transmittable, also gets around a few of those social especially that distancing concept that we've had. I was reading a study just the other day where they did when the Delta virus first really started showing up, they were doing extreme contact tracing of those individuals to try to understand how this was going about, how it was being transmitted so quickly and go through these communities. And when they did the contact tracing for one particular lady, she had been at a restaurant, and they had noticed that there had been a cluster of cases in this restaurant, and they determined that this one individual, this one lady, had went into the restaurant to have a meal, and then she transmitted it to people there. What was amazing about the Delta variant was the fact that as she was leaving the restaurant, as she was walking out the door, she passed another woman who was walking into the restaurant. Although they were within, distance, they were only within a foot or two of each other as they were passing through the doorway. Their exposure was only a couple of seconds. And in the process of that couple of seconds being within that distance of that lady, the individual who was coming into the restaurant passing the positive became positive off of COVID. So although the protections and everything are still there, you should be conscious of that. You need to understand that with these variants, some of those factors become even more important. In this particular instance, we wouldn't have established this as the original as close contact because they only had a couple of seconds of exposure, but because of the strength of transmission ability of the virus, of that Delta variant, only a couple of seconds of exposure caused her to become ill.
And Jeff, can you talk about that a little bit more in terms of, because with her, as you said, kind of walking through the restaurant, was it, just trying to understand, is the primary route that people are still kind of, getting and sharing the virus, it's still airborne, right? So, I mean, I guess if you could talk about that a little bit more, because in this case, was she, do we know any more about kind of like what the situation was in terms of like within the restaurant that day?
Yeah, well, we do know the fact that the two individuals, there's several factors that come into that. The two individuals that were doing that, neither one were masked when they went as they passed one another, and neither one was vaccinated in that. So the chances of her being able to transmit it were higher because she was unvaccinated. It had built up in her system. She didn't have her mask on, so it was more easily transmittable. There's a lot of factors that come into doing this, but if you look around today, as I go around at the end of my day in the evening, you go to the stores, you go and like that, you see many more people that are not masked. You see, we know our population needs to be become more vaccinated. So the chances of transmission in that particular instance and with the Delta variant are so much higher. We just have to take a little extra step. And what I told somebody just last night is that just because a mandate doesn't exist, that you must take a certain action, that doesn't mean common sense shouldn't step up and you should take that action just based on what you already know exists in the community.
Great, thank you, Jeff. And I know we're about at the top of our time, and so I did just want to wrap up and just kind of hit a couple points based on some of the questions that came in, and really appreciate folks sending us those questions. We won't be able to address all of them, but feel free to keep sending those. I know we've got different addresses and stuff out there where you can send us that information. And then we can go ahead and update some of the frequently asked questions that we have out there, and hopefully, get another one of these set up in the future as we get more information. But looking through the chat box, there's a couple, I think some of the easier questions, Jeff, if you could touch on them. I think one, just to kind of remind folks around, with the vaccinations in terms of the effect of being vaccinated after the first shot versus the second shot, and kind of what level of protection you have, if you will, kind of once you've had that first and second shot, particularly for like the Pfizer and Moderna vaccinations.
Right, and it's really simple. if you've had one dose of the vaccine, you're probably going to be looking in the range, it varies slightly, but in the range of about 60% greater protection from whether it's the original or any of the variants, while the second dose will get you up into the 85 to 90 percentile area once you've had it in your system for about 2 weeks. So you do get protection from the initial, but it is lower protection than when you have your final dose of the vaccine. And they're finding that with the Johnson & Johnson, since it's a single dose on there, it just simply takes a little longer in that instance. You do have a much higher level of protection at about 2 weeks, but it runs in that 60 to 70% range. But there are also some studies out there that show about 4 to 6 weeks out after the Johnson & Johnson, it's getting back up to its original levels up in that 80% range.
Great. And just to wrap up, I know a couple other questions that came in. Today, the vaccines are available for 12 and up. That's correct, right?
That's correct. And they're doing studies all the way down to I think to 5 currently, but right now 12 and up.
Right. And I know there's talk that hopefully they'll be able to have some of the younger ages potentially available this fall or later this year. But obviously that all depends on how quickly they can get the vaccines developed and tested. So again, really want to appreciate everyone who has joined us today. And apologies if we didn't get to your questions. We definitely want to continue the dialogue both with us, but certainly also within your own teams and work areas. And just a reminder, we have talked through a lot today, but if you're not vaccinated, we just want to remind you that there are opportunities to do that. Certainly we have information on our website. We can also let you know about clinics that, certainly that are happening here within Central Arkansas, also around the state. The good news is that we are at the point where any of the vaccinations that are currently authorized for use are available and should be able to access those within your community. And as a reminder, and I saw somebody had posted this on a chat, we did go ahead and we're able, for folks that were able to upload their vaccination information, we'll be able to get the vaccine bonus. So that'll be coming out. And I believe there's going to be a second round coming up as well. And we can definitely get information out about that as well. So if you didn't get in on the first round, you can potentially get in on the second round for that $100 bonus. And just as a reminder, if you do decide to go ahead and get vaccinated, we do allow folks to get time off work to do that, because we want to support you in making that decision and doing what's best for you and your family. As we've gone through this, it's important to remember that, we're all in this together, and we've got to do whatever we can to help protect not only our families at home, but also our families here at DHS. And so, again, we thank you all for participating, and certainly encourage you to reach out and continue this discussion and help us as we all try to work to protect one another.
Sorry, I had muted myself. Thank you, Dawn, and thank you, Jeff, very much. For those of you who sent questions in the chat box, our team will work to get answers to you. Jeff and Jen Schuler, our advanced practice RN, who are sort of at the top of our COVID response team here, have been living this for well over a year now. We'll work to make sure that we do get answers back to you, along with Amy Webb and our team. And as Dawn said, we will continue the dialogue. I hope you continue it in your offices, but also we will make sure that as this situation continues to evolve, we keep getting information to you both by email and then periodically like this. So thank you for taking the time to join us today. Appreciate it. Thank you, Ashley, for interpreting for us. Thanks. Bye.